So we're lucky, we actually have already relationships with those in the UK and the Netherlands and Germany have sent samples and treatments to those in those countries, and we're continuing to try to increase our footprint in the global profile. And we really think that our priorities, our mission is to improve safe access to fecal transplants and do that very, very robustly, but also to catalyze research in this space. We're a dual mission, and for us, the access issues are not just in the United States, but also in Europe, Asia, Canada, South America, and are willing and eager to listen to others that are willing to partner with us to try and increase that mission. So we're basically start to finish from poop to ready to use convenient FMT. One of the challenges in the field is no one really wants to be dealing with poop, and doctors don't have time to blend poop or find donors. We make this as ready, easy, and convenient as possible. And so essentially, we take it from the donors to all the way to the processed stool. And that goes through a number of different stages to ensure that they have a material that can be used and ready to deliver, thawed and ready to go for coloscopic administration, enema delivery, or upper delivery. So size matters in this situation. The amount of stool actually is allocated, so we can standardize each treatment to the right unit. So it depends on the size of the stool, to be truthful to you. But also I would argue to you, although it treats one patient directly, one treatment, it actually treats a number of other potential patients. Clostridium difficile is an infectious disease that spreads. And so stopping the footprint of C. difficile with that one patient has the impact to change communities, hospitals, the family members around them, and that's something that we think is very important. It got incorporated, the actual nonprofit, in 2012. It's been a little bit of a tale to get started. We've basically been shipping treatments for just over a year and a half. And so that's kind of the biggest impact we're making. So we've sent out 3,700 treatments to 290 hospitals in 45 states and 5 countries and saved the system over $64 million. The goal is to increase access and to do that in a safe way, just like blood and sperm banks are. Not only we see the amazing impact clinically on patients' lives, we see the impact on the public health system. Each fecal transplant saves the system $17,000. And so conservatively, OpenBiome, our nonprofit, has saved the system, the healthcare system, $64 million in just over a year. That's a huge impact to the system. We're looking to try and save not only, colons and lives and quality of life, but also to save systems the economic impacts. Our healthcare system is tremendously expensive, and if we're able to help make a dent and change the epidemiology of C. diff, but also to allow resources to be allocated in other places, we're all for that.